help if I turned on the microphone. There you go. Hello, everyone. Today is Tuesday. Today's Tuesday, November 16th, and I'm live. My name is Dr. Robert John. Thanks for joining me tonight. I just want to let you know that this here on YouTube, it's not an official YouTube show. This is actually just a podcast, and I thought it would be cool for everybody to just have a visual. So it's nothing fancy here on YouTube. It's just I'm doing the live podcast on Spreaker and iHeartRadio and Spotify, and I just thought it would be a good idea to show my face once in a while here on YouTube. Anyway, we're going to pick up where we left off last week, fear and anxiety. But first, last week I couldn't think of what that imaginary wall that was called in the unconscious mind, the one that blocks. It's like a protective mechanism for the unconscious. Couldn't think of what it was called. It's called the critical faculty. Critical faculty. That's what it's called. So, I'll get that out of the way. So we're going to pick up where we left off last week. There are different types of anxiety disorders. So I would like to touch a little bit on each of them. We have generalized anxiety disorder, panic disorder, phobic disorder, obsessive compulsive disorder, and post-traumatic stress disorder. So I'm going to touch a little bit on each of them. But what I'm going to do is I'm using my psychology textbook from the courses that I took. So, I'm going to use that as my reference here. I have it open in front of me. So just because sometimes my mind, my mind goes off. I have to. I've got to hire somebody to write scripts for me. Like a dictaphone, one of those dictate, whatever they're called. Those people that write down, they take notes and then they put it together. Yeah, that's me. Because my mind races and my lips can't keep up. But and it's been another emotional day, so it is what it is. This too shall pass. I'm in a better place than I was years ago, and I'm not going to let these type of things bother me anymore like they used to when I was younger and less experienced and less wise. Speaking of wisdom, before I get started on this, I want you to know that next Tuesday's podcast is most likely going to be on narcissism. I have a journal along with some study notes because I've been researching for a while now what narcissism is. And I would like to touch a little bit on that too, since we're on these types of disorders. So next week, the whole podcast will be on narcissistic tendencies. But for tonight, let's start off with generalized anxiety disorder. And this might be best described as consisting of prolonged, vague, unexplained, but intense fear that do not seem to be attached to any particular object. They resemble normal fears, but there is no actual danger. In most cases, danger is not even imagined to be present. In one study, patients with various types of anxiety disorders were asked, "Do you worry excessively about minor things?" 91% of those diagnosed as having generalized anxiety disorder answered yes to that question, and a much higher percentage than for any other anxiety disorder. Not only do individuals suffering from anxiety disorders worry about minor things that have happened, they also feel worried and tense even when nothing even mildly alarming is occurring. They seem to spend a lot of time anticipating alarms that probably will not sound. In generalized anxiety disorder, anxiety persists for 6 months or longer and is not attributable to recent life experiences. The symptoms of generalized anxiety disorder usually include motor tension, hyperactivity of the autonomic nervous system, dread of the future, and hypervigilance. These symptoms, which I'm going to describe for you, may be experienced individually or collectively in a combination. Worry and apprehensive feelings about the future. People with generalized anxiety disorder worry about what the future holds for them, for people close to them, or for their valued possessions. Hypervigilance. People who suffer from generalized anxiety adopt a sentry-like stance in their approach to life. They constantly scan the environment for dangers, not necessarily of a physical nature, although often they cannot specify what the dangers might be. This excessive vigilance is related to their hyper-aroused state because they are always alert to potential threats. They are they are easily distracted from their tasks on which they are working because of this hypervigilance, because of this alertness. Now, let's not confuse that with just being alert, because, I trained in martial arts, and our instructor made it very, that was one of the most important things, was to always be aware of your surroundings. This way you couldn't be attacked surprisingly. It wouldn't be an easy task for someone to surprise you. So let's not confuse that with someone who is just aware of their surroundings. That's not what they mean here, hypervigilance. What they mean here is someone that can't focus on a task because they are so worried about what's happening around them. All right, the next is motor tension. Individuals with this symptom are unable to relax. They are keyed up and visibly shaky and tense. Strained facial expressions are very common, as are furrowed brows and always deep sighs. These individuals are easily startled. And then we have autonomic reactivity. In individuals with this symptom, the sympathetic and nervous system seems to be working overtime. There is some combination of sweating, dizziness, pounding or racing heart, hot or cold spells, cold and clammy hands, upset stomach, lightheadedness, frequent urination or defecation, lump in the throat, like feeling like you have your throat's closing in, and high pulse and respiration rates. That is autonomic reactivity, and that is common in the generalized anxiety disorder. One study conducted in 3 cities found that between 4.1% and 6.6% of the population had experienced a generalized anxiety disorder during their lives. It is more common among women than men. The course of the generalized anxiety disorder for both men and women is usually protracted, with durations of as long as 20 years being common. The disorder tends to become evident between the late teens and early 20s. However, experiences early in life in which children feel they do not have control over what is happening in their environment or what might happen tend to make them especially vulnerable to this development of anxiety. In other words, if a child is in growing up in an environment that's loud, obnoxious, just maybe verbally abusive, or always busy, and just the typical things that bring on anxiety. If a child goes through that, by the time they hit their teens and their early 20s, it's pretty much it's set in them. It'll pretty much affect them. These are the clinical features of generalized anxiety. Excessive anxiety and worrying occurring for at least 6 months. All right. Now, the inability to control this worry. The presence of 3 or more of the following symptoms: restlessness, feeling on edge, being easily fatigued, difficulty concentrating, or your mind just goes blank, irritability, muscle tension, sleep disturbance, which could be difficulty falling asleep or staying asleep, and considerable distress or impairment in social, occupational, or in other important areas of your life. So that was generalized anxiety. Let's take a look at panic disorders. Panic disorders may attack with no warning. The indicators of panic disorder are similar to those of generalized anxiety disorder, except that they are greatly magnified and usually have a sudden onset. However, there are differences between generalized anxiety disorder and panic disorder in the risk factor, rates of occurrence, and family incidence rates. This term, panic attack, denotes an abrupt surge of intense anxiety, rising to a peak that either is cued by the present, what's in front of you, or thoughts, or particular stimuli, or that occurs without obvious cues and is spontaneous and unpredictable. Persons experiencing panic often have phobic fears that the stimuli evoke. People who have panic attacks when evoking stimuli are not present typically do not have phobias as well. Stressful life events, such as a new job, a marriage, or moving, can trigger a panic attack. In panic disorder, there is intense fear of having another attack. DSM defines panic disorder as including recurrent, unexpected panic attacks and at least 1 month of persistent concern over having them again, reoccurring. Worry over the implications and consequences of having panic attacks is a key aspect of this disorder, which is a chronic and debilitating condition. People with panic disorder need not to be anxious all the time. Instead, they have unanticipated panic attacks that recur after periods, could be several days, could be weeks, of normal functioning. Severe palpitations, extreme shortness of breath, chest pain, trembling, sweating, dizziness, and a feeling of helplessness marks these panic attacks. The victim's fear that they will die or go crazy or do something uncontrolled, and they report a variety of unusual psychosensory symptoms. In addition to recurrent unexpected panic attacks, panic disorder patients also display persistent concern about having additional attacks and what the attacks might imply. Meaning they worry just as much about having another attack, and they worry about why they're having the attack. So it's like a constant cycle. These are the clinical features of panic attacks: shortness of breath or the feeling of being smothered, dizziness, unsteadiness or faintness, trembling, shaking, sweating, heart palpitations or a racing heart rate, choking, nausea, stomach pain, numbness or tingling, chills, chest pain, a sense of strangeness, of being detached from oneself or from your surroundings, a fear of going crazy or losing control or dying. That's the panic attack. There's a case study here, but I was going to share that with you, but it's a little lengthy, so I might skip that. I want to make sure I get in these different types of disorders first. We can always go back to that case study. Let's move on to phobias. Unlike people who have generalized anxiety disorders, people who have phobic disorders know exactly what it is they're afraid of. Except for their fears of specific objects, people, or situations, phobic individuals usually do not engage in gross distortions of reality. Nothing physical seems to be wrong with them. However, their fears are out of proportion with reality. One question that inevitably arises in discussion of anxiety is why people spend so much time brooding about vague menaces when there are so many real dangers to actually worry about. Perhaps the degree of fear we feel about a potentially harmful event is linked not primarily to the degree of the threat or even the amount of injury that we imagine we might sustain if the worst did happen, but to the disturbing quality of the event or situation itself. For example, even though there are 3 times as many traffic fatalities as there are murders, our thoughts are rarely preoccupied by the danger of an automobile accident. Fear of violent crime, on the other hand, touches many of us. Crucial to the experience of fear is whether people feel that they will be able to respond meaningfully to a situation. That is, whether they will be able to cope. One of the most interesting aspects of phobias is that the stimuli that evoke them are not random. The most common fear-arousing stimuli tend to be animals, objects, or events that presented real danger in earlier stages of human evolution. Although extreme fear of dogs, snakes, and spiders seems maladaptive today, such fears may have been highly adaptive in earlier times. Some researchers believe that human beings are instinctively predisposed uh, to like or dislike and to fear or not fear certain stimuli, like snakes, for example. Presumably, fears for which we are prepared are products of millions of years of evolution. Now, phobias may begin with a generalized anxiety attack, but the anxiety then becomes crystallized around a particular object or situation. As long as the feared object or situation can be avoided, this anxiety does not reach disturbing proportions. Some objects of phobias, such as cats, cars, and stairs, are considered aspects of everyday life by most of us. Other objects and situations, like snakes and death and heights, are disliked to some extent by most people. However, phobias involve levels of fear that, in addition to being overly intense, they interfere with normal living patterns. Here's examples for 5 categories of phobias. Separation fears. Okay, crowds, traveling alone, being alone at home. Social fears, eating with strangers, being watched while writing, or being watched while working. Animal fears, mice, rats, or insects like spiders. Mountains, these are nature fears. Mountains, the ocean, cliffs and heights. Mutilation fears, open wounds, surgical operations, and blood. Some people have a panic attack when on the sight of blood. I knew somebody like that. All right, let's go on to the next. This breaks down each phobia, which I'm not going to do because I just want to give you a generalized idea. Let's move on to obsessive compulsive disorder. People with obsessive behavior are unable to get an idea out of their mind. They are preoccupied by sexual, aggressive, or religious thoughts. People with compulsive behavior feel compelled to perform a particular act or series of acts over and over again. Example would be repetitive hand washing or stepping on cracks in the sidewalk. Obsessions usually involve doubt, hesitation, fear of contamination, or fear of one's own aggression. The most common forms of compulsive behavior are counting, ordering, checking, touching, and washing. A few victims of obsessive compulsive disorder have purely mental rituals. For example, to ward off an obsessional thought or impulse, they might recite a series of magic words or numbers. About 25% of people with obsessive compulsive disorder have intrusive thoughts but do not act on them. The rest are both obsessive and compulsive. Compulsive behavior without obsessional thoughts are very rare. Compulsive rituals may become elaborate patterns of behavior that include many activities. For example, a man may require that his furniture never be left an inch out of place, while also feeling a need to dress and undress, brush his teeth, and use the toilet in a precise, unvarying order, all the time doubting whether he has performed this sequence of actions correctly, and often repeating it to make sure. Some theorists believe that compulsive behavior serves to divert attention from obsessive thoughts. In any case, compulsive rituals become a protection against anxiety, and so long as they are practiced correctly, the individual feels safe. Therapists say there are enormous differences between healthy people with compulsive streaks and those suffering from obsessive compulsive disorder. Truly obsessive compulsive people often have family histories of psychiatric difficulties, suggesting a genetic component to the disorder. They are racked by self-doubt and are often unable to make even simple decisions. By contrast, healthy people with a few compulsive tendencies tend to work efficiently and organize their daily activities to avoid confusion. They also take pride in their ability to control their emotions, and impossibility for those with obsessive compulsive disorder. Although this disorder, although obsessive compulsive people are racked by guilt over their strange behavior effects on their families, they continue because they believe their compulsive acts keep themselves and their families safe. The most common features of obsessive compulsive disorder are these 5. The obsession or compulsion intrudes insistently and persistently into the individual's awareness. A feeling of anxious dread occurs if the thought or act is prevented for some reason. The obsession or compulsion is experienced as foreign to oneself. It is unacceptable and uncontrollable. The individual recognizes the absurdity and irrationality of the obsession or the compulsion. The individual feels a need to resist it. All right, I have a few minutes left here, so we're on the last one. Post-traumatic stress disorder. Now, PTSD have both similarities to and differences from these other conditions. The major similarity is that the individual has experienced something traumatic. It's logical. However, in the case of post-traumatic stress disorder, the stressor is outside the range of common experience, meaning it is not just being involved in or observing a minor fender bender type of car accident. PTSD involves an extreme experience, such as war or a natural catastrophe, whose effect may extend over a long period. The traumas range from those that are directly experienced to those that are witnessed. The onset of the clinical condition in post-traumatic disorders varies from soon after the trauma to way after the trauma, or long after. The DSM, let me look real quick. It gives us all right. This is the guideline for diagnosing the diagnostic criteria for post-traumatic stress disorder. The exposure to a traumatic event that involved actual or threatened death or serious injury, or a threat to the physical integrity of oneself or others. A response to the event that includes intense fear, helplessness, or horror. Persistent re-experiencing of the traumatic event in the form of recurrent and distressing thoughts or dreams, or behaving or feeling as if the traumatic event were actually happening again, or intense psychological or physiological reactivity when exposed to cues that symbolize or resemble that event. Persistent avoidance of stimuli associated with the trauma, along with the numbing of general responsiveness. Persistent symptoms of increased arousal, such as hypervigilance, irritability, sleep difficulties, difficulty in concentrating, an exaggerated startle response that was not present before the trauma. Symptoms of more than 1 month's duration that cause significant distress or impairment. So, there you have it. Those are the different types of anxiety disorders. And which puts me right on time, 30 minutes. Initially, I was going to, next week, I was going to do another podcast on some herbal remedies. But like I said before, like I mentioned in the beginning, I think it's time that I start speaking out on narcissism. I think it's important that people understand what it is and the signs. As I said before, I have a journal that I've been keeping, and I've been observing, and I've been researching. And I would like to share with everyone what I've come up with. I do want to say this before I go, and I'll say it again next week. But every human being has, to an extent, a certain level of narcissistic tendencies. I mean, we can all be a little selfish. We can all have, we can all be prideful at times. Especially if it's something that we've put a lot of time in, or working on, or whatever the case may be, whether it's work related, or maybe it's a hobby, maybe something that you put a lot of time and effort into. You become prideful of that. You're proud of yourself. So we all have minimal narcissistic tendencies. But I'm going to explain to you the difference between having minimal narcissistic tendencies and being able to go down a list of tendencies and checking off each one. If you're able to check off each one, then you or know somebody that can that would apply to, you can pretty much bet that you're dealing with a narcissist. It's kind of like going into your doctor, saying, "Well, doc, I have a scratchy throat." Okay, well, are you coughing? No, not really. Have you had a fever? No, not really. The doctor goes down a checklist. So what you might have thought, was a cold, turns out just to be maybe, the pollen was high that day, and maybe you have an allergy to it or something, or maybe you were exposed to some kind of smoke or something, But if your doctor asks you all these questions and he can check off each one, he'll know what you have, whether it's a cold or an allergy or just an irritated throat. So keep that in mind when next week when I'm going through this list of narcissistic tendencies. And if you can check off or know somebody that can, that it applies to each box, then you're you can diagnose them as being narcissistic. If it's just one or two, not so much. Like I just explained. We all have minimal narcissistic tendencies about us. But anyway, I'm past my 30 minutes. I want to thank you again. Check out the website, renewingmylife.com. And don't forget I'm on Amazon. Hey, Amazon has this new thing. I don't even know how long it's been around, but I know it's fairly new. Maybe a year. It's called Kindle Vella. Vella. I'm doing a series on there. It's a weekly series where I do a write-up. And just tell you, I'm just writing about my life and my experiences as each week goes by. And I want to share with you my experiences and, how I get through some of the stressful or depressing situations. It's all part of my whole goal of teaching people overall wellness, how to keep your mind right, your body right, and your spirit right. Because, let's face it, your mind and your body can be right, but if you're spiritually gone, it doesn't matter. Nothing's going to help you. Honestly, you got to be right. You got to be spiritually right. There has to be a balance. And if any one of those are off, you'll never be at peace. You'll never find that joy that you're, So, it's my goal to teach you how to achieve each one of those. Physical wellness, mental wellness, and spiritual wellness. All right, thanks again for joining me. My name is Dr. Robert John Bonus. And again, check me out on Amazon, Kindle, and Kindle Vella. And check out the website, renewingmylife.com. Thanks, folks. I'll see you next week, Tuesday. By the way, I'm thinking about making it a little earlier, maybe 9 o'clock instead of 10 o'clock. This way everybody can get cozy and get ready for bed after the show, after the podcast. But I haven't decided that yet, so let's keep it at 10 for now. I'll see you back here next week, next Tuesday at 10 o'clock. Have a great night, guys.